Have you ever stopped and wondered if the way you've been masturbating for decades might actually be holding you back now that you're past 60? Yes, the method that once made you feel like a king in your 30s could now be slowly sabotaging your pleasure, your erections, and even your prostate health. Men rarely talk about this. Doctors rarely explain it. But today, that silence ends. Before we dive in, take 1 second to hit that subscribe button on Dr. Kayla Health Tips. We bring you real medical insights, not myths, helping men stay in control of their health, strength, and masculinity. I'm Dr. Kayla, and today we'll explore the 3 biggest masturbation mistakes men over 60 must stop making immediately and what to do instead for better blood flow, greater sensitivity, and a healthier sex life overall. Let's protect your power where it truly matters. Why things change after 60. Your body is not the same engine it once was. Testosterone is lower, blood vessels are narrower. Nerves are more sensitive to damage. The prostate needs more care. Erections are harder to keep. Pleasure can feel different. But aging doesn't mean ending pleasure. It means being smarter with your habits. Masturbation at this stage of life should be gentle, slower, more connected to breathing, more focused on arousal, not rushing. If you adjust your technique, you can actually gain back strength, sensitivity, and confidence. Mistake 1, using the death grip. Many men tighten their fist like a vice grip because they feel less sensation. But this habit over time does something dangerous. It trains your brain and nerves to only respond to strong pressure. It causes reduced sensitivity, delayed ejaculation, difficulty finishing with a partner, nerve irritation. Your penis begins to think normal stimulation isn't good enough. The solution: sensitivity, reset. When masturbating, loosen the grip. Try slower strokes, more variety in motion, less friction, plenty of lubrication, different hand positions. Train your nerves, don't overpower them. Pro tip: try holding your penis like you're holding a fragile piece of fruit instead of a hammer. Pleasure should be felt, not forced. Mistake 2, treating it like a quick stress release after 60. Stress hormones like cortisol rise faster when you rush or masturbate while anxious, stressed, or worried about performance. Blood flow to the penis decreases. That leads to softer erections, faster fatigue, less pleasure, more performance fear. And the solution: the slow build technique. Think of pleasure as a warm-up, not a sprint. Start by touching your thighs, stomach, and inner legs. Take slow breaths. Focus on the sensation, not the finish. Let excitement build like a fire, not a spark. This improves nitric oxide release, enhances blood flow, and leads to erections that feel stronger and more fulfilling. Mistake 3, sitting too long and ignoring the prostate. Years of sitting, both in life and during masturbation, puts pressure on the prostate. Inflammation can increase and urine flow issues worsen. Symptoms men notice: you need longer to finish. Semen volume becomes lower. Burning or irritation after finishing. More post-ejaculation discomfort. The solution: better positioning. Experiment with standing, lying down, or even elevating the hips. And consider warm shower masturbation. Perineum massage. Gentle pelvic floor relaxation. Your prostate is not an enemy. Treat it like a vital teammate. Bonus tips for maximum pleasure. After 60, use edging. Bring yourself close to climax, then pause. Repeat 3 to 5 times. This boosts testosterone and trains stamina. A deep breathing. Each breath brings more oxygen and blood flow to the penis. Hydrate. Blood flow depends on water. A dehydrated penis is an unhappy one. Limit porn. Fast digital stimulation rewires the brain. Go back to imagination. It's more personal, powerful, and healthier for erections. Kegel relaxation. Instead of squeezing the pelvic floor constantly, learn to relax it. This reduces tension and makes orgasms feel better and easier. What you gain by doing it right. When you adapt your technique, you unlock sharper sensitivity, stronger erections, faster arousal, healthier prostate function, higher confidence in intimacy, better orgasms than you've had in years. You're not done growing in your sexual journey. In fact, this is a chance to become the most aware, most confident lover you've ever been. A final words of a urologist: aging is not the enemy. Ignoring your body is. Pleasure should evolve with you. Treat your sexual health with the same care you give your heart or your muscles. If you protect your erections today, you protect your freedom tomorrow. Make sure you subscribe to Dr. Kayla Tark Health Tips for more vital men's health videos that keep you strong, confident, and performing at your best. Because you deserve a sex life that is satisfying, healthy, and full of pride no matter your age. Stay powerful, stay curious, and stay in control of your pleasure.